Hello, my name is Sarah Buchanan, and I will be presenting on the profession of Health Education Specialist, or HES. This profession is very dear to my heart because I hope to one day pursue it for myself. In this presentation, I will be describing the roles and responsibilities of Certified Health Education Specialists, where they work, and why they are important to society. The education required to become an HES. To obtain certification, health education specialists are required to have a bachelor's degree in public health education, health promotion, or something of the sort. Obtaining a higher degree is always recommended, but not required to succeed in this field. The classes that contribute to this degree are the foundation for one's knowledge about the profession. In addition to obtaining a degree, all who are interested in being a health educator must pass the Certified Health Education Specialist exam. The exam is offered twice every year and is a standardized, multiple-choice test that covers the 7 areas of responsibility that all health education specialists should be well versed in. What are the roles and responsibilities of a health education specialist? The first responsibility that health education specialists engage in are assessing the health needs of people within communities. How are community health workers and other public health professionals supposed to know what to focus on if we do not understand the priorities we need to have? Therefore, it is extremely important for health education specialists to engage in community assessments so they can inform their employees the plans of actions for which they can release first. Arguably, the most important aspect of health education specialists is creating and improving programs that serve the public. There are a number of ways that this goal can be implemented, such as corporate events, after-school programs, weekend workshops, or nightly classes, just to name a few. Evaluation of new or existing programs is an essential way to ensure that the intended outcomes and goals are being reached. There are a variety of tactics that can be used in order to successfully evaluate a program, such as auditing, rewriting materials or lesson plans, or surveying the participants. Plugging community members in with helpful resources allows for greater use of local nonprofits and low-income healthcare facilities, as well as promote community health. For there are so many services that are ready and willing to help out, but if the public is not pointed in the right direction and informed of these options, then how are they expected to use them? Johnny from Genesis, with whom I conducted my informational interview, worked in this field to check in with patients and give direction when needed extra services that their clinic could not provide. So where do they work? They work in healthcare facilities and hospitals, health clinics, public health departments, schools and universities, nonprofit organizations, and businesses and industries. When do health education specialists work? Hours vary based on the job title. For instance, health education specialists that work in schools and nonprofits follow the normal working hours, as well as public health departments. Hospitals and health clinics will probably have more spread out schedules and will potentially have to work nights and weekends. Why are they important? Health education specialists advocate for the health of the public. They focus on prevention of illness and disease. Health education lowers expensive premature death and disability, and lowers the medical treatment expenses. Pros and cons of a health education specialist. For pros, it is extremely rewarding, as health education specialists get to interact with the public and contribute in a team aspect. In addition, there are a variety of jobs available in different locations, so it allows for a lot of flexibility. Most health education specialist jobs are full-time and work 40-hour weeks. However, some cons of working as a health education specialist is the hefty load of education and background one must undergo before they can make a significant amount of money. Also, some jobs require you to work nights and weekends, so the hours are not ideal. Chantel Dixon began her journey in the healthcare field in her undergraduate program, where she originally wanted to pursue medical school. However, after facing difficulties in some of her classes and receiving advice from some of her educators, she settled on the path of public health. Through this journey, Chantel has held many internships within the field and eventually completed her master's in public health with an emphasis in health promotion. During this time, she developed and conducted programs for African Americans with type 2 diabetes, which still is in place till this day. Currently, Chantel holds a position at the Association of Reproductive Health as a program manager. According to her profile, Chantel organizes various programs by creating criteria, materials, and learning objectives. Finally, Chantel's advice for students that are looking to pursue a career in the public health field is take advantage of student memberships to professional organizations for the resources and networking possibilities. Finally, health education specialists are an extremely important and well-rounded group of people. They can wear many hats and therefore act as a reliable source of information and assistance within an issue. I am so excited to work towards this fascinating career. Thank you for watching my presentation.